Hello, today I will be discussing autism. I will discuss the characteristics, assessment, curriculum, and educational placement of children with autism. Autism is a developmental disability that affects a child's verbal and nonverbal communication and social interaction skills. This disability negatively affects a child's educational performance. Autism is characterized as an autism spectrum disorder. Autism spectrum disorders is a broad term that includes 5 conditions that are characterized by limitations in 3 areas of development. These areas are communication, social interaction, and showing repeating behaviors. There are 5 syndromes characterized by autism spectrum disorders. These syndromes are autism, Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and pervasive developmental disorder. The characteristics of autism spectrum disorders are as follows: lifelong disability, no specific physical characteristics associated, and autism spectrum disorders are present very early in development. Sometimes children with autism spectrum disorders are negatively affected by things like loud noises. ASDs affect children's social interactions, communication skills, and have a restricted range of behaviors. When it comes to assessment, we have come a long way over the years. Autism spectrum disorders can be diagnosed in children as early as 2 years old. By using some assessment tools such as Autism Diagnostic Observation Scale and screening tests for autism in 2-year-olds, autism spectrum disorders can be diagnosed very early in a child's life. Also, a new method called joint attentions has been implemented that can diagnose ASDs in children as early as 9 months old. Joint attentions are when 2 people, maybe a parent and a child, look at an object, then look at the other person, then simultaneously look at the object. Children with ASD need instructions that are clear, specific, and concrete. Their attention needs to be focused on specific elements of a task, and they should be intimate things that the teacher does. They should imitate things that the teacher does. Also, children with ASDs are encouraged to play with toys and play with other children. These are all effective teaching methods for children who suffer from ASD and the other disorders. When it comes to educational placement, children with ASD used to be taught lessons that were not appropriate for their age. Now, children with ASD are placed in a general education classroom learning math, science, English, and history. These classrooms help with social experiences and to build social skills. General education classrooms accommodate ASD students by adjusting the curriculum to suit the child's strengths and weaknesses.